And welcome to ENZYMENTAL. I'm Jason Carter. Polycystic Ovary Syndrome, or PCOS, is a condition in which hormonal imbalances cause small cysts to grow on women's ovaries, exacerbating the hormonal imbalance and often leading to numerous other health issues and even pregnancy difficulties. PCOS may also cause unwanted changes in a woman's appearance, such as adult-onset acne. In women with PCOS, the ovaries make more androgens than normal. Androgens are typically thought to be male hormones. However, females also make small amounts of androgens. Women suffering from PCOS have abnormally high levels of androgens, resulting in an imbalance between estrogens and androgens in the body. While PCOS was once recognized solely as a reproductive disorder affecting women of childbearing age, it's now recognized as a metabolic disorder with a variety of causes and risk factors. Insulin resistance, obesity, chronic inflammation, and exposure to endocrine-disrupting chemicals are all involved in the development of PCOS. One theory worth highlighting is that insulin resistance is a significant contributor to the development of PCOS. Women with PCOS are prone to defects in insulin signaling, which increases the synthesis of androgens in the ovaries and adrenal glands. Excess androgens encourage insulin resistance, leading to elevated insulin levels, which in turn stimulate further androgen synthesis. This vicious cycle results in a snowball effect, worsening PCOS symptoms and making women especially susceptible to weight gain and insulin resistance, conditions that significantly compound the syndrome's progression. PCOS may also be an autoimmune disorder. Due to the excess androgen production, the body attempts to compensate by increasing estrogen secretion, and this increased estrogen secretion causes the production of autoantibodies that target self-tissues. Excess estrogen has also been linked to different autoimmune diseases like rheumatoid arthritis or systemic lupus, so anyone with PCOS should consider having testing done for autoimmune markers to help discover better treatment options. Restoring insulin sensitivity, consequently, is an essential place to begin for anyone with PCOS. Maintain your blood sugar through eating regularly and particularly building a diet based on regular consumption of fat, quality protein, and fiber. And as I've told you many times before, fiber is raw vegetables and fruit. It's not bread and pasta. Exercise helps PCOS by improving insulin sensitivity and increasing metabolism. So find a form of exercise that you personally enjoy doing and try to do it every day, 5 days a week for at least 30 minutes a day. There are definitely some supplements you can take that would assist with alleviating symptoms of PCOS. D-chiro-inositol, or DCI, is potentially the most promising inositol compound for PCOS. Inositol compounds play an often unappreciated role in insulin signaling. Low levels of DCI have been observed in individuals with impaired insulin sensitivity and PCOS. And not only does DCI improve insulin sensitivity, but a significant number of women who take it also see an improvement in ovulation. DCI also helps to decrease serum androgen and ovarian androgen production, suggesting that DCI supports hormone balance. Chromium is one of the most widely studied nutritional interventions for glucose and insulin-related irregularities. Chromium picolinate specifically is the form that's been used in a number of studies on insulin resistance, and a typical daily dose of chromium for improving glucose tolerance is around 200 micrograms. There is definitely a link between PCOS and vitamin D status, as women with higher blood levels of vitamin D are far less likely to be insulin resistant. And of course, if you're going to take vitamin D, you absolutely need to make sure you're taking magnesium, because your absorption capacity for vitamin D is dependent directly on whether or not you're taking magnesium. So in this way, a magnesium deficiency, which most people unfortunately have, will contribute to PCOS susceptibility also. There is also a strong association between non-alcoholic fatty liver disease and PCOS, consistent with the central role of insulin resistance in both conditions. Hyperinsulinemia promotes uptake of triglyceride-rich lipoproteins by the liver and results in increased storage of fatty acids in the liver. Because of their strong anti-inflammatory activity, omega-3 fatty acids from fish oil help to ameliorate non-alcoholic fatty liver disease, helping to improve liver health and cardiovascular health in women with PCOS. Omega-3 fatty acids reduce liver fat content and other cardiovascular risk factors, including triglycerides and systolic and diastolic blood pressure in women with PCOS also. Saw palmetto is an herb that's typically thought of as a supplement for benefiting the prostate, but it also inhibits the activity of an enzyme known as 5-alpha reductase, thereby reducing the conversion of testosterone to dihydrotestosterone, or DHT, which is the more androgenic form of the male hormone. This may have implications for reducing acne and also excess facial and body hair. A particular form of calcium, known as calcium D-glucarate, may help to remove excess hormones. Oral supplementation of calcium D-glucarate has been shown to inhibit beta-glucuronidase, an enzyme produced by colonic microflora and involved in phase 2 liver detoxification. Elevated beta-glucuronidase activity is associated with an increased health risk involving elevated hormones. Calcium D-glucarate's inhibition of beta-glucuronidase activity allows the body to excrete hormones such as estrogen from the bowels before they can be reabsorbed. So while there are several natural treatment options available for PCOS, the first thing women can do to begin managing the PCOS is to stabilize their insulin secretions, and the easiest way to do that is to eat regularly. Thanks for watching. I'm Jason Carter, and I'll see you next time on ENZYMENTAL. Stay healthy.